The benefits of the FAST procedure is that it takes only a few minutes to do the operation versus an open procedure, which may take somewhere 20 to 30 minutes. The other benefit is the increased healing time because there's not a dissection of the tissue that needs to heal. The other benefit is the cost of OR time, and to the insurance companies is markedly decreased because of the speed in which the patient is taken back from surgery. Technically, the FAST procedure is technically easier than an open procedure because you're only making a small incision and then inserting a needle-type device to debride the tissue. From a surgical standpoint, in which you usually have to dissect through different layers, it oftentimes is time-consuming and there are vital structures in that region. One of the other benefits of the FAST procedure is that I can use image guidance, which is an ultrasound device, to put the needle in the right location. So I have visual confirmation as to the tissue that I'm debriding, even though it's a closed procedure. The experience to do the FAST procedure requires one to be knowledgeable of the anatomy surrounding the area. If you take the elbow, you need to know where the vital nerves are. Most of the procedures are done by orthopedic surgeons, though there are some primary care physicians that have some experience in taking care of the musculoskeletal system that with proper training could be capable of doing this. I would recommend that somebody do a cadaver study and listen to the rationale of how this process works and what tissue is debrided, also knowing about the temperatures of the that are generated when you debride the tissue. The FAST procedure is a technology that is unique to the musculoskeletal system, in which they're using ultrasound to debride the tissue. There are areas in other parts of the body in which this concept has been used, and that's in brain tumors. They can debride that, where different kind of cancers like in the liver and so forth. I think this technology has been used, but the FAST procedure by definition is mainly for the musculoskeletal system and using an ultrasonic wave to debride the tissue. The FAST procedure is part of the armamentarium that we have. If someone comes in with a tendinopathy, the usual treatments are to do rest, anti-inflammatory medicines, physical therapy, sometimes steroid shots. On the far end of the spectrum is surgical, where you go in and openly debride the tendon. Somewhere in between is the FAST procedure, in which you can go in there and only make a small incision, and so I think it's somewhere in between, but it may start moving into part of the frontline treatment because if you take what usually happens with somebody with, let's just say, lateral epicondylitis, which is tennis elbow, somebody comes in, they have an injection, have physical therapy, which may be multiple episodes, there's time away from work, there's opportunity costs, and so forth. So this procedure, though it may sound aggressive up front, may be part of the frontline surgery to avoid some of these time delays and so forth that patients experience. Well, unfortunately, in our healthcare world, the cost of new technology is sometimes not recovered by what insurance companies will pay, even though it makes economic sense for the patient because they're back to work quicker, they can go back and do their normal job, they're out of the operating room quicker, which also saves insurance companies money. There is startup cost and development costs for these procedures, which the companies have to recoup. And unfortunately, all that can't be bundled into what the insurance companies will ultimately pay. So it's having a problem of being adopted by some of the surgery centers because of the upfront cost. Well, I think that the FAST technique does take an experienced person that's familiar with the anatomy to use it properly. There are potentials of doing harm, so it's important to make the right diagnosis.